Assalamualaikum and good day. Hi, my name is Manali Haniti binti Mohd Zahid from Department of Chemical Pathology, University Science Malaysia. Today I would like to present my findings for our study entitled Synthesis of Anti-CD1T3 Monoclonal Antibody Functionalized Gold Nanoparticles Targeting CD1T3 Receptor-positive HCT116 Colorectal Cancer Cells. Okay, for today, I will cover the introduction, methodology, result and discussion, and finally the concluding remarks. Okay, in solid tumors, the formation of new vasculatures increase the permeability of vascular endothelial layer, resulting in leaks and susceptibility for the passage of molecule or nanosystem size. This phenomenon, known as the enhanced permeability and retention effect, or EPR effect, which enable the passive targeting of nanoparticles. Colorectal cancer is among the most common cancers in the world, with high mortality rate due to the advanced stage diagnosis and high rates of recurrence. And currently, common treatment for the colorectal cancer are including surgery, radiotherapy, and chemotherapy. 5-fluorouracil or 5-FU is an anti-metabolite for the treatment of solid cancers, including colorectal cancer. 5-FU is a natural pyrimidine uracil analog with a fluorine atom. Is inserted into the C5 position in place of hydrogen. It interferes the DNA synthesis and RNA processing and function, which eventually lead to the cell death. Gold nanoparticles or AUNPS are promising nanocarriers in drug delivery due to their unique physicochemical properties. In general, gold nanoparticles have high surface to volume ratios, which can be used to achieve passive targeting of the tumor site through the EPR effect that we have discussed earlier. In addition, ease of surface modification due to high surface reactivity of gold makes gold nanoparticle convenient for active targeting of tumor by the surface functionalization with small biomolecule. And in fact, there are some gold nanoparticle studies that have reached clinical trial and shows promising data for further studies. And actually, the success of anti-cancer therapy depends on the ability of the therapeutic to reach their designated cellular and intracellular target site while minimizing the accumulation and action at non-specific sites, or also known as the healthy cells. However, majority of the previous study were using the chemotherapeutic agent loaded onto gold nanoparticle surface only without the presence of the conjugated antibody, which is suggested to become a map for specific active targeting. So, we set out to investigate the cytotoxicity effects of carboxyl and functionalized gold nanoparticle grafted with 5-FU and anti-CD1T3 monoclonal antibody in HCT116 colorectal cancer cells. Okay, for the methodology, we have synthesized the gold nanoparticles using the decoration method, and then we modified the surface with the PEG. And then we functionalized the surface of PEG-related gold nanoparticle with the anti-CD1T3 monoclonal antibody by EDC and HS coupling chemistry before 5-FU drug loading. Then we characterized the nanoparticle by several devices or methods. And then for the in vitro study, we checked the CD1T3 expression in HCT116 colorectal cancer cells by using the flow cytometry, and then we locate the nanoparticles in the cells using the fluorescent microscopy. And finally, we run the MTT assay for the cytotoxicity study. Okay, next we move to the result and discussion part. XRD pattern of gold nanoparticles exhibit 4 distinguished peaks, confirming the crystalline phases of synthesis material is gold. Then the surface plasmon resonance or SPR peak of gold nanoparticles and PEG-related gold nanoparticles were detected at 522 and 5 to 5.5 nm respectively. This redshift of the maximum absorption suggests that PEGylation alters the dielectric properties at the surface of AUNPS. And as we can see here, gold nanoparticle colloids are ruby red in color, while the pegylated gold nanoparticle exhibit more purplish color, confirming to this redshift in the SPR due to pegylation, which can be associated with the minimum size increment from 13 to 19 nanometer as measured by the TEM. Conjugation of anti-CD133 monoclonal antibody was entailed by the redshift of the maximum absorbance by pegylated AuNPS as visible from the UV spectra, and based on the BSA standard curve, the efficiency of the uptake of anti-CD133 monoclonal antibody by pegylated gold nanoparticle via ETC and HS cross-linking was more than 82%. And then 92.4% of the cells express CD133 and they are highly expressed at the cellular membrane. Okay, next we investigated the cellular internalization of nanoparticle with and without the CD133 monoclonal antibody in the cell. And as we can see here, the accumulation of the pegylated AuNPS, which is stained with the fixed color or the green signal, was mainly at the cellular membrane, and in contrast, nanoparticle conjugated with the anti-CD133 monoclonal antibody, which is indicated by the PE signal, appeared to be contained within the nuclear region of the cell. And this finding supports our notion that anti-CD133 monoclonal antibody conjugation facilitate the specific intracellular intake. And then to assess the toxicity of the nanoparticle, MTT cell viability was carried out. And after exposing the cells to the pegylated gold nanoparticle and pegylated gold nanoparticle conjugated with CD133 antibody for 24 hours, no toxicities observed, even up to the 10% dilution of the pristine stock, which suggested that they were non-toxic and they are suitable to be used as the nano carrier. In contrast, the 5-FU pegylated AuNPS and 5-FU pegylated AuNPS conjugated with CD133 antibody significantly reduced cell viability at all tested concentration, but still the cytotoxic effect was far more pronounced for 5-FU pegylated gold nanoparticle with CD133 monoclonal antibody than without the antibody. So in conclusion, we have successfully modified the surface of gold nanoparticle with heterobifunctional PEG having a carboxyl end for anti-CD133 monoclonal antibody conjugation to facilitate specific targeting. The results from the fluorescent imaging and the viability assay suggested that 5-FU pegylated AuNPS conjugated with CD133 antibody facilitated cellular internalization and the release of the 5-FU payload at the specific site, which trigger the cancer cell death. And the abundance of CD133 expression on the surface of the CLC cell confers anti-CD133 monoclonal antibody conjugate as an excellent candidate for the targeted drug delivery system. However, additional studies investigating the pathway of internalization by CLC cells are recommended for the better insight. Okay, finally, I would like to acknowledge Nanotech Group at Faculty of Physics UPM for assistance with synthesis and characterization study, Department of Immunology USM for the flow cytometry facility, University Science Malaysia under the Research University grant for supporting this study to be conducted. And finally, I would like to thank the Islamic Development Bank under the PhD scholarship program that support my PhD journey. Okay, with that, thank you.